Hey everyone, thanks for checking out my channel. Today's video is going to be on viruses, and this lecture is going to be packed with goodness that's aimed at helping you pass your dental or medical board exams. So let's get started. So we're going to focus on the different ways that we can categorize a virus. So we can categorize it by DNA or RNA, not both. So a virus will never have both RNA or DNA. And so we have to know some basic definitions about the morphology of a virus. It's pretty easy because we don't have to know too much. So the big words that we want to focus on are capsid and nucleocapsid. These two terms are often tested on and intertwined. Since the word is so similar, you often see these two topics in the same question or the same answer choice. So it's important to distinguish between the two. So the capsid is also called the protein coat. So the capsid is the protein coat surrounding the viral DNA. So we don't want to confuse the protein coat surrounding the DNA with the nucleocapsid. The nucleocapsid is the capsid plus the nucleic acid. So make sure that you have a good handle on the difference between capsid and nucleocapsid, because that's a really easy one to get right on the test if you just know the definition. Okay, a virus can be naked or have an envelope. The envelope is a lipid bilayer that surrounds the capsid. And if it's naked, obviously it doesn't have the envelope. Okay, how to remember DNA versus RNA viruses. This one's not too bad. All you have to do is remember the DNA viruses, and then the rest are going to be RNA. So you'll come up with questions on your board exams that strictly want you to associate a virus with being DNA or RNA. And if you know all the DNA viruses, then and one of them does not fall into the category of DNA virus, you automatically know it's RNA. So don't kill yourself trying to remember, every RNA virus. Just remember the DNA ones, and then by process of elimination, you'll know which ones are RNA. So to remember the DNA viruses, you're going to think happy. Okay, so we've got HHAPP. I've got one too many P's in there. Okay, so we've got herpes, hepadna virus, adenovirus, parvopapovivirus, and pox virus. So the hepadna, I capitalized the D and A in there because that's a pretty slick way to remember that this is a DNA virus. So it's right there in the name. But you got to be careful with this method because there are a couple P viruses that are RNA viruses. So picornavirus and paramyxovirus are RNA. So you have to be careful about that. Some general facts. Viruses are obligate intracellular parasites, which means they require a living host. They replicate only in living cells. Almost all viruses are haploid, which means they contain a single set of their genome, a single set of their chromosome. And the exception to that is going to be the retrovirus family, which is diploid. And viruses are not sensitive to antibiotics, obviously because they're not bacteria. So they're going to be susceptible to antivirals. The role of the host cell. So the virus will infect the host cell, and the host cell will provide the metabolic enzymes, and the virus provides the genetic information. So keep in mind that the virus really doesn't have any organelles. It doesn't have any mitochondria, any ribosomes. It mainly just throws its DNA into the host and then uses the host enzymes and organelles. The virus must first adsorb to the cell surface of the host cell. This involves a specific interaction between the viral surface component, like a surface spike, a protein spike, and a specific cell receptor on the cell membrane. So adsorption does not involve insertion of virally specified glycoproteins into host cell membranes or use of cell energy or phagocytosis. It's strictly just a specific cell receptor on the cell membrane and a viral surface component.